But there's one step before you go down the route of treatment planning, which is we need to rule out certain types of treatment that you wouldn't want to do in the cheek. The most important of these is previously overtreated cheek treatments. There are unfortunately many patients who've had cheek treatments again and again for many years without a more holistic assessment, and those patients might need other areas treating or no treatment at all, rather than treating the cheeks themselves. We need to quite quickly rule out treatment in patients who don't need it, because it changes the conversation quite early on and it helps you get a better result for them long term. There may also be existing proportion issues. For example, patients who already have quite wide cheeks, whether they've had treatment or not, may not be suitable for additional volume without it changing the proportions of their midface in a way that isn't actually an upgrade. So understanding proportions is also key. What are the components of a chin, a jawline, a cheek? How does it fit into the face naturally, so that as you inject, you create more beauty rather than less? This is what makes for an artistic injector. It's the ability to not just understand the injection points or understand what your patient is asking for, but to actually understand the aesthetic potential of the face. It's the gap between where a patient is and where they could be. We need a framework that teaches us not just about the proportion or the techniques used, but about the actual shape and detail of different elements of the face and how it all works as a whole. Mastering this missing piece is a crucial step on the success path I've developed for aesthetic practitioners. It'll transform you from a basic injector into a confident aesthetic artist, with the ability to grow a thriving clinic filled with patients who trust you with their entire facial journey, not just individual treatments. If you would like to learn my framework, click the link in my description for more information.